Good day everyone. For today's video, we will be discussing monoamine oxidase inhibitors. Monoamine oxidase inhibitor irreversibly inhibits monoamine oxidase, an enzyme found in nerves and other tissue to break down the biogenic amines neurotransmitter dopamine and 5-HT or hydroxytryptamine and relieve depression. MOAIs are used rarely nowadays because they require a specific dietary regimen to prevent toxicity. However, there are some patients who only seem to respond to these particular drugs, so they remain available. Agents still used include isocarboxazid or Marplan, phenelzine or Nardil, tranylsilpromine or Parnate. The choice of an MOAI depends on the prescriber's experience and individual response. A patient who does not respond to one MOAI may respond to another. The MOAIs are generally indicated for treatment of the signs and symptoms of depression in patients by blocking the breakdown of the biogenic amines, neurotransmitter, dopamine, and 5-HT. Allow these amines to accumulate in the synaptic cleft in the neuronal storage vesicles, causing increased stimulation of the postsynaptic receptors that lead to increased stimulation of the receptors, causing relief of depression. The MOAIs are well absorbed from the GI tract, reaching peak level in 2 to 3 hours. They are metabolized primarily in the liver by acetylation and are excreted via urine. The MOAIs are contraindicated to patients with allergy to MOAIs because of the risk of hypersensitivity reactions. To patients with pheochromocytoma, because the sudden increases in neurotransmitter levels could result in severe hypertension and cardiovascular emergencies. And to patients with cardiovascular diseases such as hypertension, coronary artery disease, angina, and congestive heart failure, which could be exacerbated by increased neurotransmitter levels. To patients with abnormal CNS vessels or defects, because the potential increase in blood pressure and vasoconstriction associated with higher neurotransmitter levels could precipitate a stroke. To patients have history of headache. To patients with impaired renal and hepatic organ, because it could alter the metabolism and excretion of these drugs and lead to toxic levels. And to patients with seizure disorder or hyperthyroidism. The MOAIs are associated with more adverse effects, more of which are fatal than most other antidepressants. The effects relate to the accumulation of neurotransmitter in the synaptic cleft may include dizziness, excitement, nervousness, mania, hyperreflexia, tremors, confusion, insomnia, agitation, and blurred vision. MOAIs can cause liver toxicity. MOAIs effects to gastrointestinal tract can include nausea, vomiting, diarrhea or constipation, anorexia, weight gain, dry mouth, and abdominal pain. Also, urinary retention, dysuria, incontinence, and changes in sexual function. Adverse effects of MOAIs to cardiovascular system are orthostatic hypotension, arrhythmias, palpitations, angina, and potentially fatal hypertensive crisis. Other conditions include occipital headache, dilated pupils, and photophobia. The nursing responsibilities before the drug therapy are the nurse should assess the patients for any known allergies to these drugs, determine whether the female patients are pregnant, and lastly, assess the vital signs, weight, and etc. This is to determine the baseline status and for any potential adverse effects before beginning of the drug therapy. During therapy, The nurse must limit drug access to suicidal patients, monitor the blood pressure and orthostatic blood pressure, monitor liver function, provide a list of potential drug-food interactions that can cause severe toxicity, provide thorough patient teaching, offer support, and lastly, provide comfort measures to help the patient tolerate drug effects. After drug therapy, the nurse must monitor the patient response to the drugs, monitor for adverse effects, the effectiveness of comfort measures, and compliance with the regimen. And lastly, evaluate the effectiveness of the teaching plan, whether the patient knows the drug name, dosage, possible adverse effects to watch for. And that's all for this video. I hope that you've learned from the discussion. Thank you and see you on the next video.